Hello, my name is Ryan Doherty, and I'm the president and founder of Empower Health. It's currently 3 p.m. on Victoria Day Monday, and I'm going to give you a live demo of how our platform can easily help patients find healthcare services during long weekends like today. And I'm going to show you side-by-side comparisons with Health 811, Healthline 211, and other online websites, just to show you how our website has information and features that support system navigation that are not available anywhere else. Before I go into the demo, I'm going to give you a bit of our history and highlight our past partnerships with the LHINs before the LHINs split up into the OHTs, as well as how our infrastructure has been used Canada-wide as part of COVID initiatives. And so we launched our platform back in 2012 while I was completing my PhD at the University of Toronto. The platform was designed and implemented with a focus on patient experience. So any patient navigating the website in their language of choice could find up-to-date and accurate information about healthcare options. That same information would also help with healthcare system planning and care coordination, as you'll see shortly. For Holiday Surge, our platform has been heavily covered province-wide in a wide variety of newspapers and news outlets. It was even featured in Longwoods a few years ago, on hospital websites, like you can see here, Sick Kids back in 2019. And the main focus of this was to let people know this is the website you can go to for up-to-date and accurate holiday hours collected within days of that particular date, or long weekend or holiday in December. And it would direct people mainly to the holidayhours.ca website. Some of it you might have heard of imsick.ca, and that was the first website that we launched. As well, we have other initiative websites like My Flu Shots, which you'll learn about shortly. And so during our last partnership with a LHIN, again, this was right before the LHIN split up into OHTs, was with the Toronto Central LHIN. And so we'd worked with both the Toronto Central LHIN and Mississauga Halton LHIN for a few years on navigation and surge-related initiatives. However, for the month of December and early January, our focus was Toronto Central, and that's why you can see 98% coverage. And so that means that our data team and processes collected and maintained holiday hours for 98% of pharmacies, family doctors' offices, walk-in clinics, urgent care clinics, and hospital services within the Toronto Central LHIN region. During that time frame. We also, to demonstrate how our platform was scalable province-wide, even though our focus was just the LHIN, we extended out province-wide. And you can see here, even though these regions were not part of our focus, some of them like Champlain, Southeast, Northeast, Northwest, Southwest, and Waterloo, Wellington had close to 100% coverage, meaning that patients who visit the holidayhours.ca website or imsick.ca website during that month would have up-to-date and accurate information about who's open during the holiday season. And the main reason for that was to divert patients from the emerge department. The other thing I'll quickly highlight here is that we had collected over 35,000 holiday hours from close to 5,000 facilities. All of that was collected within a matter of days from the holidays during that month. And so the time window that we focus on for Holiday Surge is a 2-week window before each long weekend during the December holidays. And more generally, year round, our preferred focus is ensuring that no data for system navigation is out of date beyond 1 to 3 months, depending on the type of information. And as you'll see shortly, I'll show you how our platform's design so it can actually show real-time information collected from services, especially during our COVID response initiatives. So from March 2020 onward, we focused on COVID. And so initially it was the National Institute of Aging who reached out to us, knowing that our infrastructure was national in terms of keeping up-to-date information about healthcare services. And they said that there needs to be visibility of outbreaks across long-term care homes. And so even though we hadn't yet focused on long-term care until they approached us, we put in place, we collected and maintained information about every long-term care facility, and also added outbreak data models to that. And we were able to implement that in 10 days, just given the urgency of the pandemic on the long-term care homes and the lack of visibility of outbreaks. And so pretty much from April 2020 until July 2022, our platform was collecting and maintaining outbreak information for every long-term care home, initially on a daily basis at the start of the pandemic, and then it shifted to weekly. You can see here how, in addition to clicking on locations and seeing information about outbreaks at those locations, it also provided summaries of like, what are the percentage of homes affected within each province, how many deaths, looking at staffs compared to residents. And in total, close to 4,000 COVID cases were tracked in this platform. And if you look at specific homes, you would see the number of cases amongst residents and staff, and it provides a current snapshot. But even though you can only see the current snapshot here, our database included historical data for the number of outbreaks that had occurred each homes, and that went into pandemic reports for the National Institute of Aging. The next COVID initiative we focused on was something that actually we worked on a couple years before the pandemic. And this was system navigation for vaccinations. And so before the pandemic, we were focused on flu shots and just letting the public know which pharmacies and clinics had flu shots in stock. And for this project, we partnered with Immunize Canada and PHAC. And with this, we leveraged our platform nationally to not just show where nearby flu shots are available, but also HPV vaccinations, as well as COVID vaccinations and boosters. And for flu shots, it focused not just on general flu shots, but more importantly on where high-dose flu shots were available for seniors. And so this infrastructure, because we were working on it before the pandemic, was in place nationally at the start of the pandemic before any of the provincial initiatives around COVID rollouts were in place. And so nationally, we had over 10 million people search our website and sign up to be notified once vaccines became in stock. And we had over 1 million bookings of vaccines through our platform. This was in place, again, before the provinces rolled out their systems. And then once the provinces had their systems in place, we then shifted to other types of COVID projects, like coordinated access to COVID testing and treatment. And so this was the project we launched in January 2022, where we partnered with all of the hospitals and clinics that offered COVID testing and treatment across Central Ontario. And so from a single website, patients would go to our website and be able to book same-day appointments at any of these locations. And so there's about 5 million people that live in this region, and over 100,000 appointments and visits patients were seen for COVID testing and treatment. The importance of this is that because patients were being seen for treatments, the timeliness of access to care was very important. And so our system was used also to help coordinate staffing at those sites so that patients, when they book an appointment online, the booking window would be within 24 hours in terms of how long patients would need to wait to be seen. And it was across busy hospitals as well as local community health centers that are strategically placed near patients, so patients can easily access care. And in terms of the information available to patients, this is an example of how our platform was providing real-time information to patients as they access care, because the patients can actually see, are there appointments available at this location and the exact times in which they can be seen for patients. And so this same infrastructure is also available on our broader platform for Holiday Surge and navigation. And so now I'm going to walk you through holidayhours.ca. So from our holidayhours.ca website, you'll be able to see, search for a variety of healthcare services. So from pharmacies, walk-in clinics, hospitals, etc. So I'll just search for all options and I'll choose New Market for this demo. And so what you'll see is a map showing And so what you see here is a map showing local healthcare options, and it's only showing locations for which we've confirmed their holiday hours within the past 1 to 2 weeks. And the reason for this is this way it shows patients can ensure that the information they see here is up to date and accurate. And so if I click on a location, let's see this pharmacy here. You can see that it's a Walmart pharmacy. You can see the languages spoken. But if you click on the time, you can see their general hours, but then it would highlight the days in which the hours are different. So you can see here today, they close at 6 p.m. instead of 11 p.m. at this pharmacy. Let's take a look at, and you can also see quickly which are open and closed. And from the filters, you can even hide all places that are closed. So let's only show places that are open. And so you can see right now that's only pharmacies that are open right now. Let's check out this one here. Yes, this is that pharmacy. This other location closes at 8 p.m. Let's pick another one. This is the Metro. They close at 5 p.m. And so, as you can see here, someone could quickly and easily jump straight to, the relevant healthcare service that they're looking for, that they need to access today. The other example that I'm going to show you, just in terms of some of the other functionalities, is I'll just close this, and I'll show you the language filter. And so, let's say you're a patient that is a newcomer, has recently moved to the area, and that you need to, you'd prefer to speak to a pharmacist that speaks Cantonese. And so you can immediately see, out of the pharmacies and clinics that are open, which are the nearby ones that have a healthcare professional available who can speak Cantonese. And so you can see here these two Walmarts, that as well as this walk-in clinic. This particular clinic you can see is a bit further away, but they're also open today. And so if you have a car, you can travel that distance, or you can go to the closer pharmacy. But let's hide the locations that are only open right now, just to show more that speak that language. And let's try like Arabic and picking other languages. Yeah, and so you can see here with Arabic, there's actually a few more medical clinics that you can go to for healthcare services. And let's see. So this particular walk-in clinic, they're normally open until 5. They were open today, but they closed at 12. And so as you can see from these filters, it's easy to navigate and find out the relevant information that you need to access care right now. Now let's compare that to the other websites that exist. So if we were to look at Health 811, Health 811 is the provincial website. And let's do an identical search. Let's search for, let's say, walk-in clinic, Newmarket. And so immediately you can see walk-in clinics nearby, but they are quite far, right? And so if you go back here, you can see in Newmarket, I was able to find a walk-in clinic less than 2 kilometers away. Yet the closest result at the top here is 8 kilometers away. So let's change this to 5 kilometers and see it. Yeah. And so you can see like the list itself changes. So it's not based on distance. I'm not sure how it's sorted. And so that might confuse a patient. Well, let's click on St. George Medcare. So I don't even see that walk-in clinic in this list. Let's see. Yeah, so as you can see here, like some of these clinics, this might not appear. Let's just click on this first one either way to see the type of information they display. And so you can see here there's general hours, walk-in hours, vaccine clinic, but there's no holiday hours. Right? It has languages spoken as well, like ours, but there's no. Let's see if there's a quick filter. Yeah, you can do a similar filter too. And so if I do, yeah, it only shows that one option. And so you can see the user experience is quite different. It's a bit difficult. And when you look at quickly and easily on the map, you see, local options, and you can jump around between locations either from the list or from the map. And it looks like there's no holiday hours listed here as well. Yeah. So let's move on to the next option, Healthline. So for Healthline, let's go to the Newmarket area as well. Services near me. Let's enter Newmarket. Oops. Let's select walk-in clinics. So yeah, you can see a few options. It has the list there. It has the locations. And let's click in. And so you can see here there's no holiday hours. And the information was last updated back in 2023. Let's take a look at the next option. This was updated a year ago, right? So like I would not trust this information because it was updated so long ago. Like hours change, especially given timing with the pandemic. But there's no holiday hours as well. Let's check the next one. Yeah, no holiday hours, also updated about a year ago. Let's see pharmacies. So maybe their pharmacy information is more up to date. Yeah, so IDA pharmacy. Yep, October last year. So yeah, and it doesn't have the holiday hours. And so you can see here it has some information. It's not as user-friendly in terms of the map. Oh, you can see the map here. But there's no filters for languages spoken. There's no filters to see like who's open right now, because you need that urgency of accessing care. And also like the data itself is old. And so, yeah, like the hours likely are not even up to date. Let's take a look at 211. So Newmarket. And let's look for pharmacy. Yeah, you can see here the 211 doesn't have pharmacies, I guess. It only shows clinics and Ministry of Health's website programs. So instead, let's do a search for walk-in clinics. So let's see. Yeah, so it just shows public health clinics. Oh, yeah, here's walk-in clinics. And that, yeah, there's York, the same one we saw earlier. So let's click through. Yeah, so you can see it on the map. You can see hours, no holiday hours. So I don't know if it's open or not. And yeah, the source is not, it doesn't show when it was last updated. Let's just go back. Let's search this part here. Oops. Let's just try checking the map. Yeah, so there's a map feature. You can filter by distance, but there's no language filter, right? And so you can see user experience wise, it's a bit of a struggle. And you can even see like some of these, are quite far, right? 46 kilometers away, 31 kilometers away. Then there's the services directory. So this one here, this is not the Newmarket area. So I'm just going to walk you through sort of some of the functionality, but you can see here In the services directory, there's no pharmacies, right? Like it's just walk-in clinics. And because pharmacies offer other clinical services, like it's important that pharmacies are included. And so you can see here, let's see. Yeah, so there's this walk-in here. No holiday hours. And so when it comes to holiday hours and advanced filters like the ones that I've shown, like our website is pretty much the only option for patients. And because I walked you through examples of how we've been, have had the website in place for the past decade and I've partnered with the LHINs, there's an opportunity for this to support your region. But the other option that I'll quickly just show you is Google, because that's another place the patients can go. And so let's say Google Newmarket, right? So I'm already there. It shows the area. And so they have filters similar to ours in terms of pharmacies. And you can click on pharmacies. But again, like for that, they might say, holiday hours, hours might differ during holidays. So there's a bit of a focus on holidays, but again, they're just, many of their locations might not list holiday hours. Some do if it was reported. Where ours on holidayhours.ca, it has confidence of, each of these locations has had their information confirmed by our data team within the past couple weeks. This information about whether they're open or closed, there is a guarantee there. And there are processes in which those pharmacies and clinics can update it on the day of through our profiles and portals if they wanted to, or letting our data team know. And so with this information, I hope that you can share this video with your local Ontario Health team, with your local Ontario Health region, with any local hospitals, and your local family health teams. Holiday surge is important. It's something that these organizations work on programs for every year, especially during the month of December, but also year round for weekends like now. And our infrastructure can easily support those projects, especially because our infrastructure has been in place for so many years. And we have significant experience when it comes to the user experience for patients as they seek out care, but also how to maintain the accurate and up-to-date information for local healthcare services. Thank you for your time.